to all. I am Dr. Surej Bobbin, working as Assistant Professor in Sarada Krishna Homoeopathic Medical College, Kulashegaram. Nowadays, lots of baseless criticisms are arising against homeopathy. So I just thought to put a video for the public to make aware of the homeopathy. Now, the baseless criticisms as it is arising regarding the scientificity and the scientific basis of homeopathy. What I want to tell you is that even if we consider previous days or nowadays, homeopathy is always called it as a spiritualistic or a divine science like that. All systems are basically spiritualistic and divine, but the meaning what it is given to homeopathy is that it is just like a godly medicine, something like that. It is not at all a godly medicine, but it is one of the system which is totally having a scientific basis. Previously, during the ascent or the evolution of homeopathy, what happened is that as the physicians, not of nowadays, they used to tell that homeopathy is divine or godly like that, because they were not having a scientific explanation for that. Now, as the sciences advance, lots of scientific evidences, etc., which is supporting the scientific basis of homeopathy. And the next thing what happens is that another thing which is that in many areas it is considered under herbal medicine or some nutritious supplement like. And homeopathy is basically a complete system which holds the maximum amount of disease coverage, and especially in both preventive as well as the treatment aspect. And in this video, what I intend to tell is that usually there are 5-6 comments which always coming against homeopathy. Out of one is that organon of medicine, which is considered as the Bible of homeopathy, always tells that organ of medicine, a Bible of homeopathy, and regarding that there is only philosophical, it is only some writings are there. Now I want to tell you is that what is organ of medicine? It is a book which is written by Dr. Samuel Hahnemann, which is totally mentioning about the methodology of treatment and therapeutics of homeopathy. Why I am telling and explaining organ of medicine here? Because you must understand what is that book. You must read that book. For especially if you are some medical personnel is seeing this, please do read organ of medicine, especially the aphorism part. What is the thing which is explained in that? It is basically the ground plan which holds two parts actually. One is basically a doctrinal part and another one is basically a practical part. I am explaining here because you must understand how much deep the disease is being studied by Hahnemann in that era itself, and that totally holds the modern day medicine standards. That book is explaining each and every situation based on the modern day medical concepts. It basically has a doctrinal part which is from 1 to 71, which explains basically in 3 factors. One is the knowledge of disease. The second one is knowledge of medicine. And third one is knowledge how to choose or administer a remedy. That is the things which is there from 1 to 71 aphorisms. As it is only written in an aphorismatic style, everyone is telling that without reading that, just telling it is basically a philosophical one. Now you have to go through what is the thing it is written. And the next is a practical part, which is from 72 to 104. What it is explaining is that disease classification outline regarding the case taking, how you have to take a case. And what are the individualistic patterns, what are the individualistic things you must understand. The practical part ranges from 72 to 291 aphorisms. And which is having the first part 72 to 104 aphorisms, which is totally telling about the disease classification. If you do go through the disease classification, it is equivalent to the disease classification of ICD-10. Only some heading changes are there. And the next part is that basically regarding the second part, that is the drug proving part. Or drug pathogenetic, if you tell today, it is drug pathogenetic trial. How it is conducted, what are the things to be mentioned, how it is recorded. And the next part is basically methods of employing, including the mode of administration, homeopathic pharmacy, administration of remedy, etc. And in the last part, it is basically giving for the general hygiene and management other than the therapeutic agent. In every system, if you consider, the same thing is there. Whether it is allopathy or homeopathy, the same thing is there. But homeopathy, the importance is that it is having a book regarding that. A scientific, medical, explained one. Each and every case, how to treat, how to deal with. Without reading that, just going for the criticisms. And Organ of Medicine is, I will tell it as the most advanced medical published book for this era as well as the future eras. You have to go through actually. This is the first criticism that is always arises regarding this. The second one is actually vital force. Homeopathy, okay, everyone is telling, what is this vital force? Vital force theory has been already ruled out. That is true. Vital force theory is ruled out. Why? Because you have to understand what is meant with the homeopathy as well as with the other original vital force. In homeopathy, from 1790, Hahnemann has introduced, and in 1810 he published the organ of book where vital force is mentioned. That vital force is always mistaken with the Berzelius, a chemist, scientist, Berzelius, his definition for vital force. He was the person who has introduced the theory of vital force. That means that inorganic matters cannot be prepared in the lab. That came in 1815. The main evidence you have to think is that Hahnemann returned this vital force from 1810 onwards. Or 1805 itself he has used this word. So you have to understand what is Hahnemann meant. Later on, the most important factor is that after the introduction of vital force theory by Berzelius, a chemist, Hahnemann it was ruled out by Wöhler's synthesis of urea in 1920. So maybe during his period itself such a type of criticism may arise. That's why in the 6th edition of Organon, or the latest edition of Organon, he has changed the vital force to vital principle. Because what he meant for vital force is not the vital force theory which is put forward Berzelius. What Hahnemann meant is basically vital force means nothing. It is a life force or a life principle. It is nothing but it is, if you read the dictionary, you will get the definition for that. A hypothetical force which the functions and qualities peculiar to the living things are sometimes ascribed. Life principle. It is nothing but it is the invisible autonomic thing which is there in which is giving life for us. That is the thing. Not the one which was in it cannot be isolated in the lab. That's not the thing, vital force definition. What happens, every critic, every person who criticizes homeopathy is mistaking with this vital force theory, and they are telling that this is a ruled out one in 1820. Before that itself, Hahnemann has mentioned what is the meaning of that. If you go through the Organon, it will be clear. Without going that, everyone will be confusing with the vital force theory of Berzelius. That is the second thing. Then the third thing regarding the potentization and succussion. The preparation, the mode of preparation of medicine, two processes. What is these things? One is a dropping method, another one is an agitating method. All in it is having a regular pattern. How much force, how much speed, what is the method, everything is there. If you want to have the explanation regarding that, then you have to understand for physics theories. First one is basically, you have to understand, everyone will be knowing potential energy. What is potential? Every matter will be having the stored energy position possessed by an object. Then kinetic energy. in motion than mechanical energy, which is possessed by an object due to the motion or due to its position. And mechanical energy can be either kinetic energy or potential energy. And from that, if you routinely agitate that, it will give power. Power is nothing but the quantity work has to do with the force causing a displacement. Now if you read, just think of this method. A matter which is divided is constantly under motion in a regular pattern. Whether any change will occur in energy, you itself answer for that. And if you go through the Emil von Behring studies, he has told in his studies itself, homeopathic medicines are able to give changes at every rise of potency, or able to raise the immunity in every rise of potency. That is not the study, that is a Nobel Prize winner, Emil von Behring, who is the father of immunology. He has basically given explanation regarding that. And his studies was there, like approved, accepted studies. That itself is explaining this one. So we have a fact. The fact is that every rise of potency is raising the immunity. You have the physics in your hand. With these agitations and vibratory movements, you can have the alteration in energy levels. Now the scientific researches are to be conducted in that manner. Many of the researches are going on regarding the vibrative sciences and other things. Now the studies, lots of studies results are also coming regarding that. So it is also getting explained. And if you are telling what is the resist creating by rubbing, okay, it is understood, you can, if you are rubbing a particular dry substance over something regularly for a continuous period of time, automatically heat will be generated. How the fire is being created by rubbing. So something is there, That's something. Just why you are just seeing homeopathy in scientific manner? You just think every time it is agitating, every time it is triturated. It is in a rhythmic fashion. Two matters are being rubbed off. So some change is occurring. The next criticism is basically homeopathic preparations can be so dilute that they do not contain a molecule of the original herb. Okay, because we are considering Avogadro number. Anything beyond Avogadro matter doesn't exist anything beyond Avogadro number. So what is the thing with nanotechnology? Nanoscience is always beyond that. You consider a small amount of spark. I am giving you an assignment. You consider a small amount of spark. How much divide you, how much number you divide, how much times you divide, whether the spark can ignite fire or not. It can ignite. So division is possible. It doesn't mean that you cannot see that, so it is not there. Because we can only see up to 30 potency. So it is there up to that. After that, there is not there. How come you can tell that? So science had already went to the nanotechnology, and you are not accepting homeopathy means what is the thing? A nanoparticle can bring nanotoxicology. You have to go for nanotoxicology. What happened? Now nano poisonings are there. Killing someone with this thing. Nano poisonings. You are accepting all that things, but you are not accepting this one. What is the thing? So these are the factors that you should understand regarding the how much it is getting divisible. It is not in a sudden. It is getting divisible in a regular pattern, in a regular stream. If you're considering homeopathy wrong, then nanophysics is totally wrong. Then, another important thing is that many things, your researchers are not so complete. Everyone is telling your researchers are not so complete. Here you have to understand one thing. Homeopathic medicine, homeopathic treatment method is basically an individual based treatment. Because there is, if you ask me a question, give me a medicine for fever, I cannot tell you I cannot tell a medicine for fever, but I can tell a group of remedies only for that. Why? Because there you have to understand the thing. For every drug, it has been studied from head to foot. If you go through the materia medica part, it will be cleanly explained. Head symptoms, mouth symptoms, ear symptoms, eye symptoms, all based on all these things, we come to a drug. We study each and every individual. Based on individual personalities, we have different medicines. For example, I will tell you, a person is having fever. If you consider other systems, they will be having for fever, this is the only medicine. But here, when we consider homeopathy, the most important thing is that for fever, we will be asking the next question. What are the other things? How is your temperature spread? Whether it is the temperature distribution over there, there will be for some persons with the fever, their body will be hot, extremities will be cold. We have a different medicine for that. For some persons, there will be lower part of the body will be cold, upper part will be hot. There is a change of medicine occurs there. And if you go to the pathology, pneumonia affecting the upper lobe, there will be one medicine. For lower lobe, another medicine. If you go through the pathology, like that, the material in homeopathic medicines are explained under that headings. So in that situation, how come you can take a statistical data that is being done according to the allopathic method can be implemented over with the homeopathy? So there will be, for homeopathy, what is the thing we have to research? Modulation should be there. Individual medicine researchers are needed actually. Nanophysics and nanochemistry regarding the potency and dosage should be assumed for researchers. And also for the pharmacological researchers must be done for that. Not the thing what we are doing always that for fever, how many number of remedies, what is the efficacy of this thing? It's not the thing. We can study a drug. We can do clinical pathological trials with individual medicines. With this medicine, we can bring about this. That is the theory actually. With this medicine, we can bring about this. And in this group of personalities, with a similar nature of constitution, you can administer with this drug. Such type of researchers are to be there. So when incorporating with the other statistical studies, it will become, there will be, as we are going for the individualistic symptoms, the identical symptoms of the patient, we will not get in every patient. It will be changing that individualistic symptoms. So what happens is that we have to assume, what we have to think is that our researchers also has to be modulated. What we are doing is that we are just implementing, doing exactly that of the allopathic method. No, homeopathy is having a different method. That thing should be explained and individualized. Right now, why am I going to give you is that this is the researchers and other things. Homeopathy doesn't have any research or supporting the allopathic. It cannot be read with allopathic method or Ayurvedic method or something like that. Homeopathy is a unique system. It has to be read with the homeopathy. Then another important thing is that if you go through the materia medica, what is the thing which is explained in materia medicas? Everyone will be having a thing. What is the thing you are doing? Everyone will be thinking, you are just giving physiology in a philosophical manner. Is that thing happening in a philosophical manner? It is not happening in a philosophical manner actually. What happens, I will tell you. If a patient is having high fever, dry cough, labored breathing, and soreness of throat, these are the indications basically. With this indication, we will go in with the aconite, which is explained in our Materia Medica, William Borick as well as Richard Sureje's Materia Medica. And the same high fever with the dry cough, with the dryness of nose, headache, soreness of larynx, feels presence of foreign body in the larynx. And the picture comes. The patient is explaining with another picture. The drug also changes to belladonna. Then fever, severe body pain, gastrointestinal disorder. The drug changes to baptisia. Fever with the chillness, great soreness, aching of bones, nausea and vomiting, severe headache, which again going for Epitorium perfoliatum. Now itself I had went through many drugs. These are all basically going for influenza symptoms. Now I will tell again, if an influenza bursts out, what happens? These are the symptoms you can find in patients. With that, we are able to prescribe medicines. Fever with the chillness, pain in the larynx, cough from tickling in the larynx, congestion in lungs, respiration quick and oppressed, pneumonia. The good drug goes for phosphorus. In the same thing with the diarrhea and loss of appetite, the same symptoms associated with the diarrhea and loss of appetite, the drug changes to pulsatilla. Then for an worsened case, after influenza, respiratory failure, hypertension, worsening of the mental anxiety, etc., the drug changes to Carbovec. Then collapse of lungs, paralysis of lungs, lack of reaction, grasping for breath. In such situations, Laurocirrus is indicated remedy. So you tell, we are going to the homeopathic medicines just not only treating the symptoms, but the symptoms are basically both pathological as well as physiological as well as patient's symptom he is telling, or we are just assuming, or with all the means, with all the diagnostic means. We are identifying this thing and giving a medicine. In selection of a simillimum, it's not a simple procedure. When we are coming to, if you come through the digitalis medicine, then the pneumonia must be of the aged persons, cardiac failure following fever. In such condition only digitalis will be indicated. These are all explained from the Materia Medicas. And regarding Materia Medica, if you go, you have to understand, homeopathy is not a thing which has evolved once in a day. You have to know that for the person, Dr. Constantine Hering. After Hahnemann, Constantine Hering was an American who was assigned to demolish homeopathy. He was a scientific man. So what he has done, he went through all the methods that of Hahnemann. He reproved all the drugs that were proved by Hahnemann, and he became a follower of homeopathy. And he is the person who has introduced 400 number of drugs to total he has proved and reproved around 400 number of drugs. Out of that, some poison drugs which are very much highly indicated in case of blood disorders as well as paralysis, etc., lacus, etc., introduced by him. So it is reproved one. If you go through the Hering guiding symptoms Materia, you will get the gradation of symptoms, at what level, how much it is proved, how much it is been explained, how many persons clinically verified symptoms are recorded in that. And these are all having pure book basis. You just read through these books. Without going through this one, without going and understanding, some criticism occurs, you are going with that only. When you are going for a criticism, please go through these ones. Everyone having a concern. Homeopathy is symptom only on the basis of mind. No, never. Mind is also considered only. We are going to the most higher level, even to the, if pneumonia is there, what lobe it is being affected, what is the pathway of cure, what is, sorry, pathway of disease. We go to that extent and giving medicines. That's why always homeopathists are become, when they are told that we are doing in such a fashion and everyone is telling that you are not at all doing anything or you are not baseless, you are unscientific, they automatically, everyone's morality will be questioned. Why? Because we know the system, we know the method. Now what I had told is anything is away from science. This is purely science based, you know. Now we go for the next thing. Homeopathy can be used as preventives. Everyone is living in that genus epidemicus. That is the word which is there in homeopathy. What is this preventive? To prevent a disease. How to identify that? That is very important. It is not identified as there is some preventive for this thing or not. It is only homeopathy can be used in such a manner. Why? I will tell you. There is an external microbial agent is there. The amount of exposure is more in a particular area. In that group of people, the body automatically deranges due to this particular invasion of microbial infection, and symptoms develops. So there is basically a pattern of similar pattern of symptoms are there, and automatically outbreak of a disease occurs. So in a community, a similar amount of symptoms are there. So if a medicine which can cover the outbreak means, based on that symptoms, a medicine will be there which will be identified. This identified drug will be infused to a human body, given orally. Simultaneously, this will give a stimulus to the body, and automatically our body's immunity will raise against that particular outbreak, because and he will be get prevented from that. And this genus epidemicus, finding a medicine for genus epidemicus means you have to study in that community, you have to identify the drugs regarding that, out of that which one is most indicated, that becomes the genus epidemicus. For genus epidemicus, the preventive medicine for that time. That is cleanly proved out in Spanish flu, cholera, yellow fever, scarlet fever of 1801, then diphtheria, Japanese encephalitis, chikungunya. These all things, it has been proved out. In 1974, meningitis, which has happened in Brazil, then leptospirosis in Cuba in 2007. All these are prevented by homeopathic medicines. So what happens? I already told you. So previously I was telling some symptoms regarding this thing, regarding the influenza, which can go further. So homeopathy can be used as a preventive as well as a curative. The curative is that if you are having unidentified diseases, undiagnosed diseases, or diseases which so-called systems doesn't have a medicine, these are all we are having it. Why? We are basically treating on the basis of symptoms. The symptoms are basically identified both pathological, it can be physiological, it can be mental symptoms also are elicited if needed. So such a study of individualistic study regarding each and every a person who is affected can be studied, and a medicine is been prescribed, surely he is going to get cured. I'm not ready to tell any conditions regarding, but I am telling you the fact. If you go through the each and everything regarding materia medicus, regarding, you will understand. The next criticism which is arising is basically regarding the miasms. Miasm, what is it? It is a chronic disease. What is the thing with the miasmatic remedy? It is nothing. Miasm is nothing, but it is a method to identify a disposition. That means a person will be from birth to his death, he will be having a chain of events in his life. That chain of events are different from one and the other. From one person, it will be differing with the other. In a family, if the father is a diabetic, the child is automatically, all these things are their lifestyle disorders. Right now it is being considered and other things. But in some persons it complicates, in some persons it doesn't. The disease also varies in different persons. So by giving a anti-miasmatic, what we meant for miasm, because a deep-seated study regarding a disease with his mode of life, with his method of life, with the history of the events that happened in his life. Based on that events, we will get a disposition regarding that. That disposition is generalized under the name miasm. Based on that, we are able to prescribe a medicine, especially in chronic diseases. Chronic disease means all the deep-seated diseases which are going towards the decline. In this, with the history, we can assume this is the thing. By giving such a remedy, simultaneously it can control, it can lessen up the exacerbations. That is the importance. That doesn't mean that we cannot hold one person from death. We can just reduce. Especially this anti-miasmatic remedies, etc., comes in the treatment of cancers, malignant diseases, etc., which is very much helpful. Next thing is that placebo effect. Homeopathy, already I explained everything. Now homeopathy use placebo. Yes, surely we do use placebo. We do use placebo. Why? Because I will tell you. Homeopathic medicines, the important, you have to understand the action. The least possible amount of medicine needed to evoke the immune response of the body is necessary for the cure of it. That means for us, we will be giving a medicine one dose. But the patient has to be satisfied. In that matter, what we will do is that we will be repeating, maybe we will be repeating the medicine on the first day, then on the 10th day, on the 20th day, or on the 30th day. We will be repeating in some fashion based on the patient, nature, and his individualities. So, we cannot give you if you are giving a patient, you have to take it today, 5-10 days after you have to take it again. They will not obey. So what we used to do is that we will be keeping the medicine, we will be giving 30 doses of medicine. Out of that, only medicated ones will be either 1, 10, 20, maybe 5th one, 10th one, 15th one, like that. We will keep in between that. We will number it and give. So it is not the thing, because the patient will be many times will not be cooperative. They will forget. First dose they will take, the second dose they will forget to take. So in order to maintain a continuity, we use placebo. But in certain case of acute diseases, etc., what happens is that we used to repeat the medicine at even 15 minutes interval. In certain diseases, we used to repeat it monthly once. In all these instances, we are giving the medicine in such a fashion. And another thing regarding this one is that how the medicines are being prescribed. All the medicines are basically alcoholic preparations. So they will be having a transparent nature only. We only knowing which medicine we are putting it in. So that is the thing regarding this one. Then another right now, what is the thing is that what is the need for anatomy? What is the need for physiology? What is the need for surgery? What is the need for gynecology? For homeopaths, like that also a question is arising. You are not understanding homeopathy. Already what I was explaining, from that you must be knowing at to what level, to the most precise level, we are going to identify a drug. For that, That's why the curriculum and syllabus holds anatomy, physio, all the medical subjects, including surgery and gynecology. That's why we are using this. Now you are not having surgery. So what is the thing for you are using having surgery? We must be having a patient, a doctor means he must be having a well aware which one has to be dealt medicinally and which one has to be dealt surgically. If you don't have the surgical knowledge, how you will be able to do that? We are not going to perform surgeries, but we should have the thing regarding that. That's why it is included in the curriculum. So homeopathic curriculum and syllabus is the one which is having all these subjects as that of allopathy. No changes there. Only allopathic pharmacology is not being included. All the other things are there. Now, what is the importance of homeopathy? Homeopathy is the system which is having equally important as that of all the other systems. Why I will tell? Because all systems has its own scope and its limitations. Homeopathy is also having some flaws and limitations. Every system is having the same thing. So, if you consider all based on the condition, based on the patient, based on the nature of disease, the system also varies. Which one surgically handled? Which one should be homeopathically handled? Which one should be ayurvedically handled? So almost it is basically an integration. A person having backache, he is having a severe cardiac illness also. He cannot do with any surgery. Along with homeopathic medicines, if ayurvedic massage and other things are included, it will be more better. A person is having recurrent abortions, gynecologically handled cases. They are not identifying what is the thing. We are having medicines for such conditions. After administration of medicine, the patient is not getting abortion and he is getting clear. A patient is having a big calculi in his kidney. He is sent to a surgeon. They are doing lithotripsy and other things. After that, again, it is recurring. Whatever be the diet and other things controlled. Some constitutional defect is there. That constitutional defect can be cleared with the homeopathy. That is what we're telling in case of miasmatic diseases. So I will tell you, each and every system is having equal importance. No system is great or no system is bad. If you consider what is the things which is hindering in the method of homeopathy, it is a general concept is there. For children only, homeopathy is the best thing for children. Why? Because in children, there is no pollutions are there. Because homeopathy is basically a very minute amount. We used to give in a very minute level. It is basically very small quantity and in a very minute dose we are giving. That minute dose will be overcome with many of the drug habits like drug addicts, some severe medications, abnormal habits, non-cooperative patients. We will be telling them you have to take in this manner in empty stomach. They will be immediately taking after food. What is the use of that one? Because this is we are giving in a so much in a minute dose and minuteness we are giving based on that individual. And we will be giving to one individual for his disease. And in the home, another person also comes with the same disease, means they will be thinking, okay, that will be enough. This person will be lean, that person will be thick. Immediately giving this medicine to that thick person, it will not work. Because his constitution is not suiting that medicine. And after doing all these things and lastly telling, oh, homeopathy is not effective. It cannot be told like that. Because this is basically a very minute amount of medicine because without any side effects. So once you are using it, you have to follow the rules of homeopathy itself. Then only you will get the clear results regarding that. Without that, you will not get the result. So the things should be managed. Even at times we will be repeating this one. At times we will be using in different potencies. We are having from mother tinctures to 10M, 50M, CM, lots of higher potencies are there. Everything will be used accordingly. I will tell you, without, if you are using, but just by reading Materia Medica, you cannot prescribe these things. How to give, which patient should be given. These are all things have been explained in organon and medicine. So these are the things. A qualified practitioner only can practice homeopathy in a successful manner. Lots of hindrances are there. Now, what is the thing? Like that of every system, we are having a pharmacopoeia. The medicines for pharmacopoeia are the ones which are approved quality, when for all quality tests undergone, all the things undergone drugs. Like that in every system, if someone will be coming with this is the new medicine for this one, without doing any clinical trials, without doing any thing, they will be coming and publishing it simply and telling tomorrow this is an effective one. Such things are happening in homeopathy also, like Berlin Wall, etc. Such medicines are not at all proved ones. By just focusing on such medicines, you are telling homeopathy is ineffective means that is a bad thing. You are having more than 400 drugs in pharmacopoeias. Take that drugs, which is cleanly explained, which are clinically verified. Without going to that, you are going with the drug someone has found a fine day, so for their publicities, they might have introduced that one. You are going with that means, how come it can be? So these are the things you must understand. We are having a definite everything. For everything, we are having a curriculum, we are having pharmacopoeias. It is basically, it is accepted in many of the, more than 100 number of countries in the world. Universally accepted one. At many areas, it is considered under the herbal medicine like that. That is the problem. Because this is a very economical one. For a disease, this is very economical. So that's all hindrances occurs. And very, if you have, because not so much profitable one or something like that. This is very effective one. So you have to consider all these things. These are the things what I want to explain to you. Now you tell me, in Wikipedia itself it has been written, homeopathy is a pseudo-scientific system of alternative medicine. How come they can tell that? And they are not in an unedited manner. Because in Wikipedia, anyone can edit it with the explanations. If you give the corresponding things for the support, it will be accepted. But there, you cannot give that. Why? I don't know. I don't know why this happens to homeopathy only. Now you tell me. I had told many things. You tell me whether it is a pseudoscience or not. A patient's or a doctor's defect cannot tell that homeopathy is ineffective. Homeopathy is an effective system of medicine, which is the best, can be used as a preventive as well as a therapeutic one, and holds many areas. Now I am concluding it. The data and other things are basically thankful to my wife, Dr. Priyanka. She has helped me much. She's the person who is shooting for me. I thank her for her effort. Now my sincere thanks to my college, Sarada Krishna Homoeopathic Medical College, Kulashekaram, Kanyakumari district, which basically given me the immense platform to teach as well as to study. I thank my teachers who had given me ample amount of knowledge from the same college. And I also thank my department for colleagues who are working along with me, and I also thank my friends and my students. Thank you.